we're paying for them already. And so let's be smart about this, and if we're going to pay one way or the other, let's get them the care that they may need beforehand, and it's going to end up saving all of us a lot of money and bend that cost curve.
Okay, moving on to Beth Dunn. Beth, you go to the microphone, please. Beth is a retail business owner from Poland. Beth supports a single-payer system for Medicare and thinks that the public option must be included in the health care bill. Your question, Beth?
My question is that if we have a health care reform bill without a public option, how are we going to make insurance companies put the health of citizens before their profits when actually by law they're required to fulfill their responsibilities to their shareholders? And how are we going to make this affordable for everybody? We've got a lot of people, 10% of the country is unemployed right now. How are they going to afford health insurance without a public option?
Well, again, the public option is not going to reduce anybody's access. You know, there'll be these affordability credits that people will get based on their income, and from again $88,000 to below, you will get some affordability credits to help you pay for this. And you will take those credits and you will go to the supermarket, the healthcare supermarket, and you will then be able to pick which private insurance you want, or if the public option stays in there, or the public option. So it wouldn't be that they would, if you get the affordability credit, you just can go to the public option. You can go to the private option too, or any of the private options too. So we're increasing choice for people. And so these people will be able to go there and access whatever they want. The reason we will be able to stop insurance companies from denying people who have pre-existing conditions is because we will make it law that they can't do that anymore. Just like we made it laws to put seatbelts in the cars. And you know, the car companies didn't want to do that, but we made it because the people of the country thought that that was a good idea. And that's the same thing we're going to do here. We're going to make it law. The law of the land will say no insurance company can deny any American citizen, because this does not cover illegal immigrants, as has been stated. People have tried to say it does not. Section 246 of the bill, if you want to go and read it, that these people will be covered by the insurance companies. And it will be the law of the land that they will have to cover them. And it will be the law of the land that whatever the number may be, it may be $4,000 a year, maybe $5,000 a year, that no one can pay more than $4,000 or $5,000 a year in health care costs. So that no American goes bankrupt again because of a health care catastrophe that happens to their family. That will be law. And so those will be the protections that we will set up, and then have a panel with the Surgeon General, health care experts in the healthcare field, set up this essential benefits package. So that when you go, whether you're getting subsidies or not, you will go to the marketplace, and the bottom line coverage will be dental, eye, maternity, hospital visits. You know what I mean? So we'll build it into the system to where they have to cover these things.
This is the insurance exchange you're talking about. My question also is, you talked about how there'll be different plans, and you know, so there'll be you know, the basic plan, the premium plan, the Cadillac plan. Does that mean that people who have more means will be able to afford better health care?
Yes. Yeah, I mean, you know, there's nothing that you can do about it. If you're filthy rich, you're going to get really, really good health care, you know? But I think what we want to do is say in America, there should be a base level of coverage because it's a human right. It's not a luxury. And because it's a human right, everyone should have pretty good health care. Now, not everyone's going to have the health care that someone who is worth $100 million is going to have. You know, but our idea here is not to take that health care away from somebody who has it already, or if you have a really good health care plan, we don't want to take that from you. It's not in anybody's interest to do that, but it's about lifting all these other people up and putting protections in place to make sure that, again, this is a human right, that you can't get denied coverage. So, yeah, people who have money will have probably be able to buy that premium Cadillac plan. But everyone will have basic health care, and that will save everyone money. And if you do have good coverage now, you're paying for it. But you're also paying for these 30 million people who don't have coverage at all, and they go to the emergency room. So everyone who has health care right now is going to benefit from this, because we're going to save money, because we're going to have all this prevention in place.
Beth, thank you.
Thank you.
Jim Rose. Jim? Jim is in corporate wellness from Canfield, feels there is too much emphasis on treatment and not enough on prevention. Good question.
Evening, Congressman. Discussion is always good, but from my end of things, it seems like all the discussion is on the back end of it. How to get insurance costs under control, how to get medical costs under control, prescription costs under control. When really the facts of the matter is almost 80% of all illness is preventable. Almost 90% of what's billed to insurance is preventable. And about 95% of prescription drugs are maintenance drugs, which is a nice way of saying they're not really curing anything, they're controlling things. I've heard you allude a few times to preventative care. And I'm just looking to see how we're going to, if we could fix the problem before it starts, if we make people healthier so they don't get sick. Is there going to be anything in here for that?
This whole thing is designed for that, is to have, first of all, everyone has care. I mean, and you're absolutely right. I mean, you have said it more articulately than I have. I mean, that is exactly what we need to do, because we are paying everything on the back end when we could be preventing it on the front end. Out of every healthcare dollar that we spend, 4 cents is on prevention. 4 cents of every healthcare dollar is on prevention. That makes absolutely no sense whatsoever. If we're going to spend all of this money, let's get it up front. So what we've done in this system is we've eliminated co-pays for preventative services so that there's no excuse not to do it, both in the regular plans, the private exchange, the public option, but also in Medicare. We want Medicare recipients to go and get preventative care as well. And we think that relationship, 2 things. One is the relationship between the doctor and the patient, and by having these people, instead of going to the emergency room, going to family docs, and building a relationship with a doctor, and then rewarding doctors for the increased health of their patient, and rewarding patients for their. You should get rewarded if you quit smoking. You should have lower premiums. You know, you should be rewarded for exercising and you know, whatever. But that will be by having these people have a relationship with a doctor, and by investing in our docs too, and making sure they get trained properly and they look at things differently, that I think that will help also create the kind of atmosphere for prevention. And then again, with the insurance companies having to cover everyone, that is a significant change in what we're talking about. You're going to be a busy guy, you know, because insurance companies are going to go to all these businesses who they work with and interact with and provide insurance for. And now, as I said earlier, the game is, you got diabetes, how do we shake this person? How do we deny them coverage and get them off our rolls, because we know they're going to cost us money with insulin and everything else, and then they're really going to get expensive if it gets bad. Now, the insurance company is going to say, how do we make you healthy? How do we work with the business owner to keep your pool of people who are coming to our plan? How do we keep you healthy? What do we have to do? Do we have to pay for you to, you know, premium decreases if you exercise? Or how many of you people smoke that don't smoke now? And we want that, you know, we want verification from the family docs that they all go to now, because everyone, those kinds of things. So you get that profit motive that the insurance companies will have to keep people healthy. And I think that is something that is going to transform the system. I don't think it could be underestimated, by making sure that everybody's covered.
I think you alluded to it earlier, your chart is actually worse than what I present to businesses. We say insurance, based healthcare is up 87% since 2000. Your chart goes back to 1999, and I guess when I'm in front of business owners, especially small business owners, that's their biggest concern is,